Hi, I'm Joy Rabanal under the class of Dra. Annabel Borromeo will present about the systemic lupus erythematosus. The content of this video is the pathophysiology, clinical manifestations, nursing interventions, laboratories and diagnostics and treatment of the disease. What is SLE? SLE is a multi-system inflammatory disorder associated with abnormalities of the immune system. It is an inflammatory connective tissue disease of unknown cause that occurs chiefly in women and is characterized especially by fever, skin rash, and arthritis, often by acute hemolytic anemia, by small hemorrhages in the skin and mucous membranes, by inflammation of the pericardium, and in serious cases, by involvement of the kidneys and central nervous system. SLE has predisposing factor, which is age, gender, hereditary, race, and hormonal, while precipitating factors such as environmental, drug-induced, and infection. Drug-induced lupus includes drugs hydralazine, quinidine, procainamide, phenytoin, isoniazid, and dipenicillamine. These drugs are known to stimulate the immune system, causing SLE. SLE results from an abnormal reaction of the body in which immune system cannot tell the difference between harmful substances and healthy ones. That results to an overactive immune response that attacks healthy cells, tissues, and serum proteins, leading to local tissue damage. It can develop glomerulonephritis, photosensitivity, butterfly rash over the bridge of the nose and cheek, and anemia, leukopenia, thrombocytopenia, fever, fatigue, malaise, the painful swollen joints, alopecia, and painless mouth ulcers. Local tissue damage can lead to change in systems. First, in the integumentary system, immune complex deposition, inflammation of dermal epidermal junctions, and vasculitis. In the renal system, deposition of immune complexes in glomerular basement membranes. In the gastrointestinal, leading to mucous membrane ulcers, organ infarction and necrosis, leading to collagen degeneration and vasculitis. Musculoskeletal system. It increased fibrin deposits at synovial surfaces, inflammation of the arterioles, venules, and tendon sheaths, eventual necrosis. Cardiovascular system. Diffuse vasculitis, inflammation and scarring of atrioventricular and sinoatrial nodes, inflammation of pericardial sac. While in pulmonary system, there is pleural inflammation, pneumonitis, pulmonary hypertension. Neurologic system. There is immune complex deposition, antineuronal antibody activity, leading to cerebritis, seizures, organic brain syndrome, and peripheral neuropathies. Systemic lupus erythematosus can be diagnosed through ESR or elevated sedimentation rate, CBC which has a presence of anemia, decreased WBC and platelet count, ANA which detects antibody produced by DNA causing tissue damage, SLE which has a titer of 1:20, lupus erythematosus cell prep, anti-DNA or antibody test, which is more specific for SLE, urinalysis, BUN, and creatinine, which has an elevated BUN, creatinine for renal damage. Some of the clinical manifestations will be intervened by limiting sun exposure from 10 to 3 p.m., keep skin dry, proper and frequent hand washing, aseptic technique during IV insertion, provide adequate nutrition, good oral care using soft bristle toothbrush, good grooming using electric razor, monitor CBC, renal liver functions and interpret the test. Physician may prescribe drugs for the S.L.E patient such as corticosteroid, NSAIDs, hydroxychloroquine, immunosuppressive or cytotoxic agents, cyclophosphamide or azathioprine, sunscreens, SPF 15, dialysis for renal failure. By choosing this case, I learned more about the disease. And that's all about systemic lupus erythematosus. This video is for partial fulfillment of the requirements in medical surgical nursing 2. Joy and Rabanal reporting.